sign up for our newsletter, and be sure to follow us on social media for more information on all of the resources that we offer regularly and a lot of special resources we're offering during COVID. And you can also learn about and register for other upcoming events. So if you haven't done so already, please take a moment to add your contact information into the chat feature. Following the event, we'll go ahead and share that information with attendees so you can stay in touch with each other. And also, if you have any questions for Dr. Kalyanaraman, please feel free to add them in the chat box as well. We'll do Q&A at the end of the event. And now I would like to introduce Anne Arundel County Health Officer, Dr. Kalyanaraman. If you've been watching the news or any of the press conferences with our County Executive, Stuart Pittman, Dr. K is going to be a very familiar face. He and his team at the Health Department have been working so hard since the beginning of the health crisis to understand the severity, symptoms, and how COVID is spreading. And we're so grateful that he's taken some time out of his busy schedule to be with us today. He will be sharing a brief presentation, and then we'll have time for Q&A at the end. So again, if you have any questions as we go through the presentation, please go ahead and type them in the chat box, which we will be monitoring. So now I'd like to turn it over to Dr. K.
Thank you, Christy. Thank you. It's good to be here with y'all. Some times gone by, we'd be in the same room, but Zoom is where we live now. I wanted to do just a short presentation just to lay out kind of the state of the county and some tips and suggestions we have for small businesses. And then really devote the majority of the time to discussion, questions, that kind of thing. So give me 1 second here as I flip over. I don't know about y'all, but I have about 53 windows open, so it's always a challenge to figure out where I am. But I think you can see this. Should be able to. So really wanted to run down 3 things. What our priorities are as a county, and I think that those are, I always include this slide at the beginning. It helps orient what it is that we're actually trying to a brief overview of COVID-19, then recommendations for small businesses. Our goal is to keep Anne Arundel open, and we do that by keeping people healthy, by preventing illness and death, by getting schools to be able to open in person, and keeping businesses open as well, and then promoting mental and social well-being. This is a trying time, and we're now in month 7 in Maryland of a global pandemic, and it's really challenging for all of us, particularly as we enter the holiday season. And I think the key goal that we really focus on is prevention. How do we prevent disease spread? And so, just as an overview, stuff that you know, we're less than a year into a global pandemic. This was first discovered in 2019. First case in the U.S. was in January. And the first case in Maryland was in March 6th. Our county had our first case on March 11th. And to date, there's been nearly 11,000 cases, 250 deaths in our county. So what does it look like? When we started, we talked about the first 3 symptoms: fevers, chills, cough, shortness of breath. But we know that there's a wide range of symptoms for COVID-19. So fatigue, muscle, body aches, headache, sore throat, congestion, nausea, vomiting, diarrhea. A lot of these symptoms overlap with the flu or overlap with the cold. It can make it really hard to tease apart what's happening. New loss of taste or smell, I skipped that one on purpose. That is something that is really specific to COVID-19. And it may not always be readily apparent to people that it's happening, right? When you're getting a cold, things might taste funny. But this is less about funny, and it's about just not being able to taste or smell. And it's particularly relevant because what we're seeing is that a lot of people are going out thinking that they have some cold symptoms, runny nose, a little cough. They're like, it's not that bad. Kind of back to how you used to think last September and October. And we're finding that they're turning out to be COVID positive. And so it's really important to keep that in mind, and we'll talk a little bit more about that. what we're also learning is that there are some long-term effects from COVID. There's been a lot of news about COVID's not that bad, people recover. I think what's important to remember is that it's true for the majority of people, they don't become severely ill. They have mild symptoms or they're asymptomatic. The challenge we have is that for about 10 to 15% of cases, it is really severe. And by severe, we mean requiring hospitalization. And typically what you're seeing for people who require hospitalization is that their oxygen levels are low, they're having trouble breathing, they're having blood clots, inflammation in their organs, which are causing damage. 5% become critically ill, requiring an intensive care stay. And what we're seeing is that for these people with severe disease, well, we'll get to that in a second. What we're seeing is that most people recover, but deaths are probably the biggest thing we focus on. It's the fourth leading cause of death in Anne Arundel, the third leading cause of death in the United States. And keep in mind that when I say fourth leading cause of death in Anne Arundel, it didn't show up in our state for 2.5 months into the year, and we still have 2.5 months left. So the tally isn't done on this. And that's just a graphic representation of what that looks like in terms of the blue bars are 2018 data on deaths, and the red bar is the COVID-19 data from 2020 superimposed onto that. Depending on how this winter goes, it may become the third leading cause of death in the county. We don't know. I started talking about the long-term symptoms, and this is what we call the long-haul survivors. So some people who survive, and particularly in people who have severe disease, who are hospitalized, they can have symptoms that last for months, even in people without underlying health conditions. And what we're seeing are things like neurological symptoms, confusion, memory loss. If you've read any newspaper articles about fogginess or brain fog, that's what they're referring to. That can persist for weeks and months. Pulmonary symptoms like shortness of breath, cough. And we're seeing also a lot of mental health symptoms, anxiety and depression that are coming both from COVID and also in the general population, and that's a separate issue. Fatigue, diarrhea, nausea, vomiting, and persistent loss of taste and smell. And so we want to keep in mind that there can be longer term consequences from COVID beyond just death. And I think that's really different from the flu, where while we certainly do have people who die from the flu, we have a vaccine, and one of our biggest challenges is that only about 40 to 45% of people take the flu vaccine. We every year wish we had that number up in the 90%. We could probably do away with flu deaths in this country if we did that. But with the flu, for people who do get it and recover, and don't die, they generally recover without any persistent symptoms. And that's really what makes COVID different from the flu. Now to focus a little bit on data, what we're seeing. Our goal really is to get to less than 1 case per 100,000 people. In our county, we have about 579,000 people. That would be fewer than about 6 cases a day. We haven't been there. And we don't count the beginning when we didn't have testing. If we could do that, we would be able to open up our activities much more. It would mean that we had contained the spread. And we see that in certain countries in Europe and Asia, that they've been able to do that containment. In countries that are countries that have the resources we have, and countries that don't have the resources we have. If you look at a country like Germany or South Korea who have advanced healthcare systems, maybe not so surprising. But then you also see countries like Vietnam who've been able to do a really great job by targeting public health interventions at containment of COVID-19. Just to dig in a little deeper on that, we look at our case rate trend and we, sorry about that. And we look at our case rate, so how many cases per 100,000 per day, because that's a really easy way to compare how we're doing compared to other counties and states. So for example, if we had 50 cases in a day and Montgomery County had 100 cases in a day, we would have the same case rate because they have about double the population we do. And so when we look at our case rate, we see that in June was when the governor relaxed on 3 consecutive Fridays. relax some of the restrictions. The green line is Anne Arundel, the blue line is the state case rate. And we see that our case rates were going down, and then they kind of hit their bottom in late June. It typically takes about a couple of weeks for the effects of any change to show up on data. So pretty much on cue, about a week after the last relaxation in June, we started to see our case rate go up. And it's been slowly going up ever since then. There have been some peaks and some surges and some resolution of those, but they never come back down to where they were. This peak that we saw in July, August, never came back down to where it started, right? That would be here. This is the lowest it got. We saw a college testing peak, didn't come down to where it was. We saw some with Labor Day, didn't come down to where it was, not for us. And so we continue to go up. Our case rate is around 12 right now. And this is our challenge, is that the higher the case rate, the harder it is to both open up and to maintain services as people see more and more infections and frankly become more and more concerned. Just for some recent data, we're seeing hospitalizations going up in our county again, which is troubling and something we're going to be keeping our eye on. But our larger term trends show that we have kind of two main areas. One is that COVID tends to be more prevalent in the 20, 30, 40 year age group. 20, 30, 40, and 50 year age groups. But the younger you are, the less likely you are to die from it. That said, we're certainly seeing many younger people who are having severe symptoms, hospitalization stays, but because they are younger and have fewer health conditions, they're more likely to survive, but they have those longer term impacts. The deaths certainly are clustered more in the upper age range. And we're finding that people who are older, people who have chronic diseases, essentially when there's a higher case rate, are restricted from their activities. They are self-selecting themselves out of activities. And it's really hard for them to be able to engage socially or engage in the workplace when the case rates are this high. And so one of the things we really think about is how do we have that equitable approach to COVID in our county and in our state by getting the case rate low enough so that really everybody can participate socially and economically. Another thing we see is that there's disparities by race and ethnicity. It's a little bit of a busy slide, so I'll walk you through it. The green bars are just the demographic numbers for our county. About 67% of the population is white, about 17% Black, and 8% Hispanic, with 4% Asian. And we really want to look at how many cases are there by ethnicity and how many deaths are there by ethnicity. And what we see is that overall, since the beginning, for Blacks, there's about a 1.5 times higher rate of deaths than one would expect based on demographics. And also an increased number of cases based on demographics as well, about 1.3 times as many. For Hispanics, it's about 3 times as many cases as one would expect. But the deaths are about what you would expect. And so these types of health disparities are pretty replicable across the state. It changes a little bit in details across the country, but it's persistent across the country as well, and reflects a variety of issues. One thing we see in Black and Hispanic populations is that a greater proportion of lower wage workers, frontline workers, also greater chance of, a lesser chance of access to healthcare, access to testing. And so these factor into our approaches to how we're going to contain COVID, and we have particular initiatives targeted to addressing those disparities. So what are the activities we're taking? A broad range of activities. I'm not gonna go through all of these. I just wanted to make you aware of them, but I did want to identify 2 of these activities that really are probably the most relevant to what you're doing and seeing in the community. One of them is testing. Testing is a key part of our containment strategy. it's the reason we continue to expand testing and promote testing throughout the county. We're now testing in excess of, and by we, I mean not just the health department, but health department, hospitals, primary cares, urgent cares throughout the county, testing about 2.5% of the population each week. And so that amounts to somewhere north of about 13 to 14,000 tests per week. The health department, we have 5 drive-through locations in Annapolis, Glen Burnie, Odenton, Deal, and Severn. And then we have pop-up clinics for testing 5 days a week throughout the county. And those locations change, and they're really meant to get into communities where there might be transportation issues, disparities in COVID rates, and also just to increase awareness. And then we have strike teams that go out to vulnerable populations. So detention centers, homeless shelters, nursing homes, to provide targeted testing to populations that may not have access to it or are particularly vulnerable. And then the other piece is enforcement. So enforcement is a large part of the activities that we undertake. We get a lot of complaints, over 1,300 complaints so far. And we investigate every one of them. So we never rely solely on somebody's either email or phone call to say, okay, there's a violation or an issue. We go out. And in only about 12% of those cases have we ordered an immediate compliance, which is essentially a warning that says, we found that there weren't masks or distancing, or you weren't cleaning properly, something like that. We ask folks to remedy that on the spot. And then we'll follow back up with a visit within 3 days to make sure that those changes have held. We've only done 2 closures. We've made it really clear that our goal is to help businesses safely stay open, not to close them. It's why we focus on the educational piece of this. And I can tell you that those 2 closures, man, we should have closed them sooner probably based on what they were doing. But our goal, like I said, is education. And so we wanted to make sure we gave them chances to improve what they were doing. We're also available for folks to call in for advice, questions, and we've certainly fielded those. Those don't show up in our enforcement stats, but that's a core part of what we do, and we've partnered with the AADC, with the Economic Development Corporation, on providing that kind of support to businesses. So what can you do? How do you create a business that's COVID ready? And hopefully everything I'm telling you here is something that you've heard or read, but it's, so much of this is education and repeating and kind of just iterating to do better. And so one of the key things we recommend for businesses is to identify a workplace coordinator for COVID-19. Somebody who's going to be your point person to handle those issues, to stay up to date, to share information with other staff. Looking at your leave policies. So what flexibility do you have for people to stay home when sick, or for their ability to care for family? And I think this is really important because when, we think back to a year ago, all of us went to work with a little sniffle, cold, cough, push through, right? All of us Tylenol'd our kid up at some point and sent them off to school or daycare. And I'm guilty. I'm not going to throw stones without acknowledging what I've done. But it's those kind of things that make a COVID response really hard, right? Because those things that we did just to kind of make the day go by, they don't work in the COVID universe, right? So when somebody's got a cough and a runny nose, they should stay home. And our leave policies have to be able to acknowledge that what might not have risen to the level of leave in the past needs to change these days. Things like telework are really helpful, but they're not available for every job out there. The checkout clerk at the grocery store is not going to telework. That's not a thing. So being able to do telework for as many people as you can decompress your businesses when you don't have the ability to telework. Flexible work hours are also another opportunity to try to space people out through time. So staggering shifts, if that's possible, in a way that has fewer people in a workspace at the same time, but may lead to overall the same number of hours in a day. I think the last is key, making sure that you have emergency planning for mass illness or quarantine. We haven't really seen too many instances of mass illness, but we have seen instances of mass quarantine because of cases. And how do you maintain essential functions? How do you maintain your business continuity? And what are your communications plans for that? Taking some time to think through that, or at least to identify people who are responsible for that, is going to be really important as we enter the fall. And then some environmental things. I'm going to repeat myself, encouraging employees to stay home when sick. It's one thing to have a leave policy that allows that. It's another thing to promote that as a part of your culture. And so would ask that you really encourage employees to stay home when they're sick. Masks, key, probably the most important thing we have, require their usage, and to also provide them for staff and visitors or customers, depending on the business. Distancing is critical, of course, establishing policies and environments to promote distance. We've all seen the stickers on the floor that are 6 feet apart. So things like that, environmental cues that help people understand what that distancing looks like, is certainly very helpful. Routine cleaning. Routine cleaning is every business does that, making sure that you're doing that with products that are going to address COVID. I think a critical piece is asking employees about their concerns. It's a really great way to do a couple of things. One, to get input on things you may not have thought about. And two, to show employees that you care enough. A lot of people are pushing through, but it's a really anxiety-provoking time. Just taking a few minutes out to ask employees can make a difference. Provide educational materials to your employees, and then minimize face-to-face contact when you can. And there's a number of resources, and I'm happy to share this afterwards, but there's a number of resources that you can refer to: CDC, OSHA, Maryland's the Maryland Business Response, and then Anne Arundel County has resources not just for businesses but also for programs in the county to help people who may be struggling with things like rent, mortgages, water bills, food access, that kind of thing. So with that, I'm going to end that. Let's chat.
So we had one question in the chat so far, and I'll encourage you all to, raise your hand, and we'll go through the questions that way if you don't want to put them in the chat. But Derek asked, is Anne Arundel County contact tracing?
Yeah, so we have been doing contact tracing since day one for every single person who is positive in the county. So that's the nearly 11,000 people. We're unique amongst the large counties in Maryland. No other county has done 100% contact tracing. In fact, we're probably one of the few counties in the country that have done that. And we've done that for two reasons. One, it's really important to be able to identify cases and break that chain of spread. And the second is that it's really a critical way to get information out to people and provide supports to people. One of the pieces of our contact tracing has been the case management we do. So providing housing supports, food supports, transportation supports. We've actually moved people into hotels for 14 days to support their isolation and quarantine. So that's a core part of the work we do, and we've committed to that by hiring up a whole staff of contact tracers.
I had another question come directly. Why is there a difference between the Maryland state numbers and the Johns Hopkins numbers that are reported on the news?
So the Maryland state numbers are it's mainly the percent positivity that usually gets the attention in terms of difference. There's just different ways to calculate it. For Maryland state, they're using what I would say is a more precise way to calculate it. For Hopkins, because they have to use a standard methodology across all 50 states plus DC, they have to, I don't want to say shortcuts, that's not the right word, but they have to kind of blunt some of the data so that it's applicable across all the states, because different states report data differently. And so generally we go with we're much more in line with NDH in terms of our data and our data reporting, and that's what we rely on for operational decision making. I think the Hopkins data is good for giving you a sense of what's going on and comparisons across states.
So, Doctor, if I understand that correctly, you're kind of saying that the Hopkins or across 50 states, there may be gaps in the data, so they can't pull it down quite as far?
I think that's exactly right. Yep. Some states have gaps, some don't, and they have to account for all of that.
So there's a couple more questions in the chat. One from Ed is, what is the turnaround for testing currently?
The turnaround currently is about 2 to 3 days. It depends a little bit from site to site. But generally, we're seeing 2 to 3 day turnaround time. Most of our sites are around 2 days.
And then another question, are you suggesting other means to prevent, contain COVID-19 in addition to the CDC guidelines?
I think that this is the challenge. There really isn't anything more to do. It's more our ability to do these things. It's our ability to consistently mask, consistently distance. It's a pain in the ass. Nobody wants to do it. And so we let our guard down every once in a while. And that's the challenge, is keeping up this response over months. I think the other piece of the recommendations are to limit activities to what is necessary. And as time goes on, what is necessary expands to things that are, I think important for social purposes. And I don't mean to diminish it in that way, but that is how COVID gets its foothold. And that's the challenge we're facing.
So I was curious, you had mentioned that there are a couple countries that are having really good responses and containing really well. What are they doing that we're not doing?
There's a couple of things that they're doing that we're not doing. One is consistent messaging. I think we have seen that there's inconsistent messaging across, when you go across federal, state lines. You can read the news and you can see that you see different messages from different people. That's confusing to people. And that's not really, none of us would operate our organizations or businesses that way, where 7 different chiefs were saying 7 different things. That's one. And the second is focusing on suppression. There's two main approaches. One is suppression, one is mitigation. Suppression means we drive the cases all the way down to 0, or as humanly possible, close to 0. Mitigation means we're trying to prevent further spread. And one of the key things that we needed to have done at the beginning that would have helped us a lot more now is to focus on suppression, to really drive down the cases to as close to 0 as possible. Because when you do that with an infectious disease, it gives you a lot longer recovery period afterwards, where the cases are low, where your mitigation efforts, then contact tracing, testing, are much more effective in picking out those few cases and breaking that chain of transmission. We didn't suppress it. In our county, the lowest case rate we got was 3.5, which works out to about 20 cases a day. But from that level, you saw, and I showed you that graph, it just continued to rise slowly. And all of our efforts are really keeping it from going up much faster. And so those two things, consistent message and a focus on collective suppression, would have changed the trajectory of our recovery.
Doctor, I participated in one of these video chats yesterday with another group in the area. And one of the participants, she owns a human resource consulting group. She said they're not calling on clients, everything is done virtual and all the rest of that. I think she may have said that that's their plan throughout 2021. And then in discussing, what we're doing personally, it sounded like maybe she and I'll say spouse probably haven't really gone out to restaurants and things. Now she's in her, I would estimate, mid 50s. I was a little surprised because I've been trying to venture out to some restaurants and things like that, cautiously, and the ones that have a lot of space. And I guess I would have considered clean before, we were dealing with this. So in the medical community, are you getting charts and graphs from the mental health people saying like, where are we psychologically? And maybe that was the age chart that you were showing before.
Yeah, so this is a bit of a challenge, right? Because we don't, from a mental health perspective, we're trying to see what is it that would show up in the data that would indicate effects from COVID. We see an increase in calls to our warm line. Our warm line is essentially a mental health support line run by the mental health agency. And it's really an opportunity for people to talk, to seek resources, to essentially not wait until things are a crisis, because we also have a crisis line to get people into treatment or care immediately if they are in crisis. But we've seen an increase in calls to our warm line. That's both a good and a bad thing. It's good that people are calling it, but it's also a sign of increased need, right? But it's hard to see anything beyond that. We don't necessarily see more emergency room visits or hospital visits for severe mental health disorder. How to read that, I don't know. Is that because people don't want to go? Because nobody wants to go to the hospital at this time? Is that because there isn't a greater need? The way mental health care is delivered, and even healthcare is delivered now, is really different with telehealth. And so it's harder to see that there's more visits or not, because all our data is really kind of scrambled up about that. So I don't know how to answer that question from does it meet a clinical level versus is the impact there? Yeah, the impact is there. It's just hard to say what the longer lasting implication is at this time.
Okay, I'm going to ask my question. Dr. K, I think you alluded to why, say, South Korea and other countries are doing better. They do a full-blown quarantine. If a village shows someone came from the contact tracing perspective, they shut it down. We are between those two conflicting worlds of wanting our so-called freedom versus, and also keeping our economy running. We're in those two worlds, and I think what I'm seeing, and my fellow chamber members know I'm like a COVID chaser now, so I have too much information. But what I will say is that I think that folks hearing the conflicting messages that are happening at our national level are really starting to listen to the healthcare professionals. And I think they have to come out as the leaders in this movement, because the rest of the stuff is political jargon, and it's for political means. It's not for keeping our families safe. My brother died from COVID. My classmate died. It's not a hoax. It's real. So I think when the health professionals take the lead role, people start saying, okay, that's why I asked the question, are you doing something beyond the CDC? The CDC becomes fickle. And I don't know if they're politically driven or what, but they become fickle. The things we know about this virus is more than enough for us to start knocking it down. The good news about our state, we're doing better than Florida, Texas, and California. But we're seeing an emerging trend, because I'm the guy watching those stats every day. And I'm the guy reading all these medical reports and how this virus is living longer than once presumed. But I think the health officers have to start putting forth the agenda that says indoor environments are risky. Our children going back to school, we haven't seen anything yet until January. Some of the states that let their kids go back, those kids are bringing it back home. you know, because the stats said, hey, you can't get it if you're under this age. Well, guess what? 13-year-olds will bring it back home and destroying families. So I think we're learning more and more each day, but we don't know because we're in that steady state process. But as we open up our economy, we're going to see how this thing has its third wave, second wave, like the 1918 pandemic had 3 waves. And we didn't want to talk about what got eliminated during that time because we have better tools than we have now. So my suggestion is the health officers really have to step forward and start giving clear direction. Don't mince words. People can choose to not wear a mask, just don't not wear it in my presence. Okay, you can't choose to give it to me. That I'm not having. You know, so I think you guys have to step forward and give a clear direction. You know.
And I appreciate that. And I think one thing that we really think about is that the economy and health are not in opposition. Our economy will do best when we suppress COVID. Full stop.
There's another question in the chat. Do you feel that it's safe to go to the hospital or primary care for other than COVID reasons? If there's a need to go to the primary care physician, should you wait or is it safe to go?
I think it's actually quite safe. The hospitals, the primary care offices, any healthcare providers have put into place a couple of things that I think are really geared to this moment. One is that there's an expansion of telehealth opportunities. And so that option is certainly in the outpatient setting available. And then the hospitals in particular, but all of these facilities have their PPE protocols in place to be able to manage this, including screening for COVID symptoms and making sure that staff as well as patients are safe. So I would say absolutely. And I would say that probably by around April, May, all the practices had really got down what they needed to get down and had the supplies to do what they needed to do.
Speaking of supplies, are people able to readily find the supplies that they need? I know at the beginning, all the PPEs were in short supply. Are you finding that they're able to find what they need now?
Yeah, we're seeing that that masks, gloves, gowns, shields, all that kind of stuff is available, and generally adequate supplies are there. I think the larger issue is what happens if there are multiple states with outbreaks. All of a sudden, your PPE consumption goes up everywhere simultaneously. That's the bigger problem that we have. But our city, we're still able as a county, as a state, to handle isolated outbreaks without any problem.
Okay, we have another question in the chat. Do you know what the pandemic has affected or how it has affected the budget for Anne Arundel County?
Yeah. We are facing a budget deficit. A lot is in flux based on the CARES funding. So the county got $101 million of CARES funding directly from the federal government. Still questions about how much of it can be carried over into calendar year 2021. A lot of the discussion at the federal delegation level that we're pushing is that we need continued support in 2021 because as a county, as a state, we have to operate with balanced budgets. So a lot really is left to be determined, but right now, not the greatest position.
Another question from the chat. How safe is air travel?
That's a really good question. Air travel in general, we recommend doing it if it's something that is necessary. How you define necessary is up to you. And one of the keys is making sure that everybody is masked during that flight. And different airlines have different policies on seating and whether they're going to seat people separately, meaning creating seats keeping seats open between people, or if they're going to pack their cabin as they usually did. Um, I think this is a good example of everything during COVID, which is how do you reduce risk? Not is it risky or is it not risky, but how do you reduce it, right? So take trips when you need to, not because you want to, like we might have before. Masks, are you wearing it? How many people are wearing it? Seating, and when you add all of those up, is the risk worth it to you? I think that's really the approach to thinking about air travel, or any travel, frankly.
So are you able to see any, I know flu vaccinations, flu clinics have started. Is there any outlook on how effective the flu vaccine is this year?
We don't have good data on that yet. Typically, it takes a few months into the new year to see the effectiveness. We encourage everybody to get vaccinated during September and October. I'm getting mine on Friday. I hope you all have, or you have plans to do so shortly. And we give those timelines because it really ramps up in November, December, January. So we want people to be vaccinated before that. But on a kind of related note, what we saw during the southern hemisphere's winter months, so July, August, was that because of the distancing, because of the masking, there was a decreased rate of flu. All of the things we say that are precautions for COVID are tremendously effective against flu and colds. So we're hoping to see a decreased number of that, but ultimately we'll see what the data shows.
So if someone has never gotten a flu shot, would you say this is the year to start doing that?
I say that every year, but yes, this is even more the year to start doing that.
I have a question. I guess I'd like to use this as a focus group. Let's say the chamber were to have a networking event, and the idea that I was having was to have like a food drive. So I take my pickup truck, and everybody who comes brings some food, that gets donated to one of the food pantries, okay? And then I would be willing to match the weight of the food in dollars to that food pantry. Now this event that I'm envisioning could be held outdoors, possibly at a high school or a community college that has a running track around their, say, football field. And the participants, for networking, you could have a line of socially distanced person around the inside track, and then skip a few lanes and have another line of socially distant persons. And the the inside, let's say, walks clockwise, and the outside walks counterclockwise. So you're basically coming by people occasionally that you haven't seen in a while, which I personally miss, and kind of like musical chairs. You could stop the music every once in a while, so you could have a socially distanced meet and greet with your old buddies like Ed Coogan that I haven't seen other than on the screen here in a while. Would you think that that would be a plausible idea, or it's like you're crazy?
Maybe.
And I'd like to hear what the other members, would you attend something like that?
I would.
Dr. K, what are your thoughts on that?
So we And really try to recommend that we gather as few folks few folks together as possible, um, in general. And I think the reason for that is that no matter how well we plan, we see that people are people, and it's hard to maintain the sort of safety guidelines that we talk about. So one of the biggest things that we see and that we talk about actually is that it's good to have a plan, but the question is, how are you going to enforce it? Because it's always in the execution that we see the people just want to get together and give their friend a hug or high five or whatever. And so sometimes it's just easier to avoid temptation.
We have another question from the chat. Are you seeing more cases in certain parts of the county? And if yes, where?
So we look at in our map on our website, we look at the rates, because places that are more populated are going to have more cases. That's what we would expect. So we try to look at the rates, and what we're seeing is some of the rates are, particularly in the northern part of the county, Pasadena, Glen Burnie, are a bit higher, and then down in Lothian as well. But what we're seeing in Annapolis, of residents of Annapolis, isn't as high. And I think some of that has to do with targeted testing. Targeted testing in Annapolis, precisely because it's denser. It's a bit easier to actually get it in there. Pasadena is particularly difficult because while it's heavily populated, there isn't necessarily any center or particularly high density areas of Pasadena. That makes it just more challenging to get information out and to get testing out. And we kind of operate a whack-a-mole operation. So whenever we see a higher rate somewhere, we start going there and kind of keep doing that as the data comes in.
So as the weather starts to change to cooler temperatures, and our restaurants are one of the ones that are really struggling with being able to have enough capacity to pay their bills.
Mm-hmm.
What is the county thinking of for these restaurants, and being able still to socially distance but to still operate where they're not losing money?
Yeah. Restaurants are probably in one of the worst positions of any business out there, because the nature of their business activity requires you to not use some of the COVID safety interventions. So you can't wear a mask and eat. The whole point of going out with others is to sit at a table and talk to them, not to sit 6 feet away from them. So distancing and masking aren't, sort of contraindicated to dining, which puts them in a really bad spot. And what our data is showing is that actually bars and restaurants are disproportionately places where people who are positive have been in the past 14 days compared to other locations. This goes back to what I was saying, that suppressing cases is probably the best way to keep the economy going. It's hard to do that in this. At the same time, we're looking at how we can expand outdoor spaces for people, what that looks like with tents and heaters and that kind of stuff, but maintains ventilation and air circulation. I think for the county, that planning is close to complete, if not already. Actually, I haven't checked my email today. Same thing for the city, that planning is underway as to what that looks like. And then additionally, once again, some efforts at the state level to try to provide targeted economic relief for restaurants and bars.
So the cases that you're seeing, the uptick from the restaurants and bars, is that mainly inside? Can it be attributed to inside seating, or is it they're outside and just not doing the proper precautions?
It's actually a combination of indoors and outdoors, so we have broken that up. indoor is a bit higher, as you can imagine, but outdoor as well. Um, and so outdoor is certainly safer than indoor um, for decreasing the spread.
I did just receive an email from the county this morning saying I haven't gotten to read the whole release, but they are pushing through some permitting and things like that to help people with their outdoor dining. So it's probably what you were referring to. So we'll be sharing that on our social media
Excellent.
and in our newsletter shortly. I had a question that was kind of along the same lines with the restaurants. As we all know, it's been difficult for them to stay in business. A lot have closed and a lot are struggling with the restrictions on capacity. People are worried that their outdoor seating is going to be shut down soon because of weather. Has there been any consideration on extending the table restriction from 6 people to like 8 or 10 people? Mainly, like I know some families that have 5 children and 2 parents, and that's 7 people, so they can't sit together. It may be restricting some larger families from going out to eat, which is frustrating to the restaurant, but also to the families. Has there been any discussion about maybe extending that to 8 people instead of 6?
Yeah, not really. So those are actually state guidelines.
Okay.
One of the things is that whenever the state relaxes, we can choose not to go with that relaxation, but we can't relax further than the state.
Oh, okay, gotcha.
So those are currently the state guidelines, and there really hasn't been any discussion up to this point about that. I do know one of the conversations has been around other ways to things like plexiglass barriers or indoor ventilation issues and how to address some of those. Those are under discussion with the Maryland Department of Health.
I had just one more question. So I have a senior this year. Any best guess on whether they'll be returning to school at all?
Oh, don't do this to me, Kim. That one is, so we've been working in partnership with AACPS to work through what are the conditions required to get kids back into school, and it's a combination of what families want, teachers, and also our case rate in our county. I think that as we go along and as we see what happens over the winter months, maybe there's a possibility. I just don't know. My crystal ball gets real fuzzy about a couple of weeks out, so I just don't know what the end of the school year has in store for us.
Okay, any last questions before we close up today?
Yeah, I'm just, I live in Harford County, and, we're going back to, some of the kids are going back to school, 1 day a week and then 2 days a week. And they're going to start opening up sports, because we already got the email on that. What is Anne Arundel County doing in that aspect? Because, I know that they go to class, they still have to wear their mask, they're looking at a computer. So some kids aren't going back, but they are going to be doing competitive sports.
Uh-huh.
Is that what Anne Arundel County is doing?
Yeah, the school system is moving forward with sports. I think next week is when it comes back online. Don't quote me on that. It's not next week. It's the following week. There's also a plan in place for K through 2 to open on November 16th and grades 3 through 5 on November 30th, assuming the case rate supports that opening. And we need to see our case rate in the 5 to 10 range to support that. And right now we're at 12. And so the school system will have to make a decision closer to that time whether they're going to have to, whether they're going to be able to move forward with that plan or they're going to have to remain virtual.
If some of those schools you said would open on November 30th, isn't that within the, whatever you call it, the bad period, right after Thanksgiving, when you're going to have the possibility of families coming together, and then you're going to send those kids in? I mean, somebody should look at a calendar on that one, I think.
There's a lot of.
I'm sorry. I'm sorry.
That's okay. That's okay. I think that I think what you bring up though kind of gets to a point that we talk a lot about, which is what is it that each of us can do to help slow the spread. And one of the things that we're talking about for the holidays is how are you going to have your holidays this year? We're used to having everybody together. This huge family gatherings, and thinking about holidays a little bit differently this year. How can you change a little bit to decrease the size of the gathering, or to have shorter encounters? One of the long lines of things that COVID changes is also going to be how we experience the holidays.
Okay. Well, I think that does it. Right at 11 o'clock. So thank you all for attending today's event. We hope that you learned a lot of great information. I know that I did. We will be sharing the chat and a link to today's video recording in the next 24 hours. And we do hope that you can join us for more of our upcoming events. Tomorrow we have a virtual networking event at 11:30 a.m. And on November 2nd, we will be hosting our virtual economic forum. We'll have the senior economists from the U.S. Chamber of Commerce, as well as the 3 CEOs of the economic development agencies for Anne Arundel, Howard, and Prince George's counties. And our next small business seminar is on November 4th on flexible workforce and staff augmentation in a post-COVID world. So again, a special thank you to Dr. Kalyanaraman from the Anne Arundel Health Department. They are working so incredibly hard to keep our community safe during this unprecedented crisis. And we appreciate their service and his time spent with us this morning. So thanks again to Dr. K and for all of you for attending, and we hope to see you soon. Have a great day.
Thank you.
Thanks. Take care.